The Persona IQ Smart Knee is introduced as an implantable device that integrates sensors within the joint. It received FDA approval in 2021 and was developed by Zimmer Biomet in collaboration with Canary Medical, with headquarters in Warsaw, Indiana. The device collects mobility data such as cadence, range of motion, stride length, and daily step counts, all while maintaining a battery life that extends beyond 10 years. The engineering design relies on built-in sensors including a 3-axis accelerometer and gyroscope. These sensors measure cadence with plus or minus 5% accuracy and range of motion within 2 degrees. The data is transferred wirelessly through encrypted Bluetooth Low Energy to a secure cloud system for analysis. By monitoring biomechanics in real time, the device provides insights into the gait cycle, including the stance and swing phases. Tracking load distribution and range of motion recovery allows rehabilitation programs to be tailored to the individual. The knee continuously measures stride length, cadence, and the weekly progression of motion, helping clinicians monitor recovery trends. Kinematic analysis highlights typical movement patterns. During walking gait, hip flexion averages about 30 degrees, knee flexion near 60 degrees, and ankle dorsiflexion around 10 degrees. In seated flexion, the hip reaches about 55 degrees, the knee bends to 78 degrees, and the ankle dorsiflexes about 14 degrees. These measurements capture functional mobility during daily life. The clinical impact of continuous monitoring includes early detection of stiffness, which helps avoid complications. Remote monitoring reduces the need for hospital visits, while real-time gait feedback supports rehabilitation adherence. Patient-reported outcome measures indicate higher satisfaction when recovery is closely guided. When comparing Persona IQ with traditional total knee replacement, clear differences emerge. Data collection is continuous instead of relying on periodic X-rays. Motion accuracy is within 2 degrees compared to 5 degrees with a goniometer. Recovery timelines shorten to about 8-12 weeks with personalized tracking, compared to 12-16 weeks with standard in-person protocols. Follow-up is often managed remotely, while traditional methods require in-person visits. Limitations still exist. The battery life, while long, is finite. Local data storage is capped at 90 days before requiring secure cloud transfer. Costs are about 15 to 20% higher than a standard total knee replacement, and the system depends on reliable, secure cloud infrastructure. Overall, the Persona IQ Smart Knee integrates biomechanics, engineering, and digital health to improve joint replacement outcomes. It provides continuous objective data that helps guide rehabilitation, enhances patient monitoring, and bridges engineering innovation with clinical care.